We move on to the next session, and I would like to call upon the chairperson, Dr. Shalini Joshi, who's the Additional Director, Internal Medicine and Metabolic Health, Porters Banarkatta Road, Bangalore, for the last 17 years. We welcome you on stage, ma'am. And Dr. Yashaswini LS, who's the Consultant Physician and Diabetologist at Bangalore Hospital, Bangalore.
Should we start? So I call upon today's speaker, who does not need any introduction, Dr. Shubhashree Patil, Consultant Physician and Diabetologist at Diabetes and Wellness Clinic, Mumbai. I hope your flight was pleasant.
Yeah. A very good morning to everyone. At the outset, I would like to thank Dr. Manohar, the whole organizing committee of Disha, for giving this opportunity on this esteemed forum. Today, my talk is non-scientific, but yet very relevant to our times. I'm going to speak on role of social media in healthcare. Social media has become an integral part of healthcare landscape and offers opportunity as well as challenges to all the doctors. So this presentation will explore the do's and don'ts of social media use as well as the benefits it can provide for professional development, patient engagement, and also we will discuss how the AI algorithms will shape the healthcare content in social media in year 2026. Now, my dear friends, this is a very typical case scenario wherein a patient walks in the morning OPD to a senior physician diabetologist who is a 62-year-old patient as first patient for his first consultation. A typical type 2 diabetes patient, hypertension, ISG, CKD with EGFR of 70 and HbA1c of 8.5. He's already on the medications, that is glimepiride, metformin 1 gram, statins, blood thinners. Reviewing the medical history and the drug history, the doctor decides to start the patient on sitagliptin dapagliflozin combination along with the existing medications for better diabetes control. Genital hygiene precautions were explained as usual, and patient was asked to follow up with fresh sugars and urine reports in 30 days. What happens next is unexpected. Within 30 days, the patient is admitted with a history of fever, UTI, and sepsis. CT scan shows there's a prostatic hypertrophy, there's a renal calculus, there's left-sided emphysematous pyelonephritis. Since the patient was not settling, a DJ stent was put in situ, and conservative management, the urologist had to plan the nephrectomy. And post-operatively, the patient went in sepsis, ARDS, and expired. What happens? The patient's son typically goes on Google. He searches out that the SGLT2 inhibitor, which was added by the diabetologist, typically gave rise to these kind of complications, and gripped by his father's death, he decides to file a case of negligence to doctor and inform a television and media person to teach doctor a lesson, and with the intention of revenge and defamation. Now the media person contacts the treating doctor and asks for an interview appointment. Treating doctor sees this as an opportunity to explain his good intentions, agrees to it, expecting media and viewers may understand his side as well. Now, next 1 minute, I'm going to tell you the conversation which will happen between a social media person and the doctor. The social media person typically asks the doctor, "Doctor, were you aware that these kind of medications gives urinary tract infection as a side effect? Aren't you aware of this?" Doctor says, yeah, but they are very safe medications. We have been using this for years now, and we know that these typically help with cardiovascular renal safety, but this is one unfortunate event where the patient landed in complications. Here the social media person says, "Doctor, have you taken a good history of the patient? Do you know that he had a prostate, he had a renal stone, and it could have been risky to give this kind of medicine to the patient?" He said that there is no need to do a fresh sonography, and neither only having a history one odd time of a UTI would stop me from giving this medication. Are you telling me that you could not take the history because you were not in your senses? Are you telling me this? He says, "What do you mean by saying that I was not in senses?" She says that the day the patient visited to your OPD, your social media had this picture of you holding a glass of alcohol in your hand and chatting with your friends in your so-called medical CME. So is this what you do in CME? Do you take alcohol? This is what is the medical conference is all about. And that tells me that for the morning OPD, you were drunk, you were inebriated, You were under hangover, and that's why you could not take a proper history and start the right treatment for the patient, which landed up this patient into complication. And today, if this son has lost his father and you have orphaned him, that is because of your alcohol abuse, and you have been an alcoholic doctor. He says, what are you talking about, doctor? I am a doctor. I was perfectly in my limits. I knew what I was doing in my OPD. I was not at all under the influence of alcohol. I'm sorry to say, doctor, this is what the picture on the social media tells us. I have been a treating doctor for years together. I have saved so many lives. Okay, so you're trying to tell me that this gives patient, that gives you a license to kill this patient by treating under the alcohol? Look at this. This is what today's doctors are all about. Drinking at the CMEs, treating patients wrongly, landing them in complications, and that is what the doctors and the medical profession is all about. Isn't that one social media picture tainted the whole profession? Is it right for anybody to label us as doctors as alcoholics, even though we are not? So, as my dear friends, you see this case scenario, this could be just you and me next time in front of a social media handler. So we need to be very cautious when it comes to social media use. And now I'm going to take you through my presentation, which is going to tell us how do we leverage social media for our professional development. Connect with the peers. Yes, we need to use the social media to connect the peers. Professional groups, thought leaders, engage in discussions to stay up to date in industry. Showcase our expertise. We should share our knowledge, insights through blogs, posts, videos, tutorials, and speaker engagement to build the reputation, but everything in the right manner, within the limits, within the guidelines which have been given for social media use. We can explore new opportunities through social media, look for job openings, speaking engagements, collaborations. Yes, we can do that. But at the same time, protecting patient privacy and confidentiality becomes very important aspect. We have to avoid identifying our patients on social media. We need to respect the boundaries. We should not engage in any personal or medical discussions with the patients on social media, as this can compromise the doctor-patient relationship. We have to comply by the regulations. We have to familiarize ourselves with HIPAA guidelines and relevant laws to ensure that we are not violating the privacy and confidentiality. We have to maintain the professionalism. Anything which goes on social media is there to stay. And nothing that goes viral can be completely removed out of social media. So once it's there, it's there. So you have to make sure to feed what is right. Healthcare marketing and statistics. Now let's look at what are the healthcare marketings and statistics. What does it hold for future? Healthcare providers are embracing data-driven marketing strategies to reach and engage patients, which is not wrong. So from telehealth adoption to personalized digital experiences, these statistics showcase the evolving landscape of healthcare marketing. And consumers, our patients, also expect digital experience. We are now moving to a digital world. They want online appointments. They want the patient portals through which they can access their medical records, their communications with the providers, and manage their healthcare at a go. They want, with a click of a button on their mobile phones, they want that they should be easily accessible to their doctors. Health information should be easily accessible to them. They can easily book an appointment and consult their doctors. A lot of patients who come to me in my OPD tell me that, doctor, we read some good reviews about you, and that's how now the patients are reaching our OPDs. So let's accept it that social media reviews do influence their decision making. 92% of the patients read online reviews before selecting a healthcare provider for themselves. Reputation management becomes an important aspect. That's why healthcare organizations need to actively manage their online reputation by monitoring and responding to the patient reviews. Feedback opportunities. Online reviews also give us sometimes valuable feedbacks that we can work on. We can definitely make our clinic, our setups better. We can make them more accessible to our patients, comfortable appointment handling, easy for them as well as us to organize our work. What are going to be the marketing trends in year 2026? In year 2026, the healthcare marketing will focus on AI-driven personalization, video content, and omni-channel engagement. We have to have trust building through reputation management, educational content, and local SEO will be the key. While data privacy and self-scheduling tools will enhance the patient experiences, the world is going AI. We also need to progress with the world. Healthcare marketing trends. We have to ensure that we have our accounts on Facebook, Instagram, YouTube, and LinkedIn. And they should be the right kind of information and content is dispersed through these channels to our patients so that it doesn't harm in our reputation in any ways. So should doctors invest on social media marketing? There has been a lot of doctors who say that this is just a gimmick, madam. What is the point if a patient is just reading a review and coming to you? But ultimately, for a patient footfall, what is the harm in having a social media account? What is the harm in having a SEO? Maintaining the patient in our OPD ultimately is our skill. It's our skill that the patient would follow up with us. If it's just a social media gimmick, the patient may not land up later to our OPD. So let's accept that the social media is an essential part of millions of people's lives worldwide. Do you know how many mobile phone users we have now in India? We have 68% of people, that is 5.44 billion people are now using mobile phones, out of which social media is accessible to 64% of patients. So these are the patients who are going to be active social media users, and we want to reach out to people to the max, and that's why social media is going to play a very important role. Now let's see what is the way that our patients look at the social media. Patients are using social media to look for health information. You and me, we are in the OPD dispensing health information for how much time? 5 minutes? 10 minutes? Is it enough for a patient to dispense that much information? Isn't there a health gap that we are looking at? Isn't there a need-based reason that a patient would look out for the 6-day rules? What should I consume when I'm not well? I have vomiting. Should I take my medicine? Should I not? Many of times our patients are now looking at social media to understand what should be done regarding their health, wherein we are falling short to be available to them all the time. Patients are increasingly using online social networks to connect with the other patient. There are peer groups. When it comes to diabetes, there are diabetes community, multiple sclerosis community, there is stroke community. Everywhere the patients are having communities wherein they are reaching out to each other for help, for guidance, for many things. So online health engagement resources promote sharing of information, support integration among the patients. Aren't we losing a lot of our patient base to social media? Yes, we are. What is Healthify? What is Fitify? They are taking the obesity patients from online and they are using them to give them the desired results by pushing across their schemes, their nutritionists, and aren't we losing our patients to them? These are nothing but the social media platforms. We also don't know what kind of information is being imparted. We are the healthcare providers. We are supposed to give the information. We are supposed to be treating the patients. So why not establish our presence on the social media? Now, what about physicians? Aren't we dependent on the social media? Yes, we are. The survey tells us that about 485 physicians found almost 58% of respondents told us that they use social media for various information access that they need. Where does professional need social media? We need it for healthcare news, for certified courses, for medical conferences, clinical trial data we find out through the social media. We do the networking with the peers, we discuss the patient cases. We also get our clinical discussions and journal clubs through the social media. So isn't social media an integral part of a healthcare provider? Yes, it is. We cannot be away from social media at all. So that's why the physicians use social media. We can use social media for providing the right information, right content to our readers. That is providing diabetes information. We can definitely give that informal education and support. It will complement our practice. It will also give some amount of formal education to the patient. If any Tom, Dick, Harry can do it, why not we as doctors give the right information to our patients? Definitely we can. Isn't it a part of patient education? Yes. We are consulting in our OPD for about 5-7 minutes. For rest of the information, anyways, the patient for informal education is diverting to social media. So as you can see here, the average person in diabetes spends no more than 0.1% of their time in the course of entire year to discuss their health matters with a medical professional, and that's just insufficient. What are we supposed to know in this arena? We are supposed to know the NMC guidelines in India, which are very relevant to medical practitioners. There should be a strong focus on ethics, professionalism, patient privacy, and truthful communication. The guidelines are part of RMP professional conduct, and they are very relevant in 2026 as well. Now, The last part of the discussion, how is AI going to shape the healthcare content on social media? Everywhere the AI use has become very rampant, and it definitely helps us as well. So we can personalize our content delivery through AI. The AI-based algorithm will now analyze user behavior and deliver customized healthcare content based on interest, health condition, and search history. For example, if a diabetes patient is looking out for a diabetologist near me, diabetes information near me. So somehow through the AI algorithms, your videos will start propping up on his social media feeds. You will start talking about diabetes. The patient will also know where your clinic is located, how qualified you are, and that is how the patient will be driven to your setup. And that's what the AI algorithms are all about. So for the patients to get the right information, the location, AI algorithms will definitely fetch the right information for them and fetch you the right patient that you want to have. What are the target-based ads? They are created for highly targeted social media ads, which will give the right message to the right audience at the right time. So today, if I need a bag, probably that is where my social media is going to start feeding me the various options of bags that I want to buy, and that is what is happening in healthcare as well. So these target-based ads is going to give the right information to the patient. We can curate this content. We cannot let anything go by our name in the social media, so we have to curate it. We have to make sure that the articles, blogs, and the videos that are going to social media are very relevant. They are personally made by us, under our supervision, done in the right way, and plus it imparts the right and the ethical information to our patients. Predictive analytics. AI predicts trending health topics and emerging healthcare crisis. Why do you see that suddenly so many Ozempic, GLP-1, tirzepatide videos are propping up in the social media? Why do you think it is happening? Because the world is interested in them. People want to hear about them. And that is what the predictive analytics is all about. It is going to tell you that this is the most relevant topic. Doctor, please talk about it. And that's what patients want to hear from you. That is the predictive analytics. And engagement optimization. Just last 2 minutes, ma'am. So engagement optimization, so therefore the posting times and content formats also matter. The social media person will tell you that post your content in the morning at around 8:30 because that's when the people go to their work and they have a time, they scroll through their phone, and that's where your content will be more visible to them and you will come to their notice. At the same time, the social media person can also tell you that, madam, please post this video at 5 o'clock in the evening because again the same office going people will be coming back and will be scrolling through their phones. So even the timings at which you deliver that content really matters. Ethical content monitoring is very important. Now AI will give you the red flag. Please, this content is not good to be posted on social media. It contains patient's name, information. Any confidentiality breached, your message will be labeled as a red flag. It will tell you not to post this message, not to be going against the social media guidelines that we have. Privacy and security concerns. While using social media, there are going to be drawbacks. We need to be aware about those drawbacks. There are privacy and security concerns, misinformation and unverified. Lot of content is there on the social media, and health meals spread really quickly. Distinguish credible sources are very important while dispensing this information. Professional boundaries and ethical considerations need to be kept in mind while using social media. So we have to mitigate these risks, but we need to make sure that the social media is used right. We have to develop social media policies, promote digital literacy, and enhance security measures, and definitely use it to us as doctors for their benefit. The future trends are going to be virtual healthcare communities, telemedicine integration, AI-driven chatbots, which are going to help our patients solve all their medical-related queries. Influence-driven health promotions will happen in near future, and we are bang right looking at it. Now, to conclude this whole discussion, I would like to say that social media has profoundly transformed the healthcare landscape. We have to offer significant benefit in communication, education, and professional development. These platforms spread rapid information. They disseminate this information. When we do a camp, we can spread this information to 100 people, 200 people, but social media goes to thousands and thousands of people, and we are able to dispense that kind of information very rapidly to our patient base. We can give them the patient engagement support that they are looking out from the healthcare providers. However, the integration of social media in healthcare also presents challenges. So let's accept that there will be challenges that you will will encounter, which will include privacy concerns, spread of misinformation, ethical dilemmas, and breaching the professional boundaries. To harness the full potential of social media mitigating its risk, healthcare organizations must implement comprehensive policies, promote digital literacy, and enhance security measures. Ongoing research, education, and collaboration among stakeholders is essential for navigating the social media landscape and ensure that social media serves a force for positive change in healthcare. Thank you so much for the patient hearing. I hope with this presentation, I have emphasized upon the fact that social media now is an integral part of all our lives, and we need to understand how to use it right. Thank you so much.
I think she deserves another big round of applause from the back. I think need of the hour. I thoroughly enjoyed it. It was fantastic, and you covered almost everything in a very crisp way. And the example you used in the beginning was absolutely useful. Anybody, we were going to take one question, and it should be very short, two sentences question.
Just more of a comment on her. Phenomenal presentation with a good language, the flow, everything is excellent. And I think the best social media partners that you can have your own patients, referring more patients. That's what we are seeing nowadays in the trend. I think we need to concentrate on the patients who are impressed with you and they are the safest, advertisers for you. That is the best thing. We should not keep it simple. Don't do too many things. Is the best idea.
Thank you so much. I think Dr. Manohar wants to say something.
I would like Kashinath Dixit sir to give a very brief account of what he is doing, just for the people to understand that doctors also can be YouTubers and social media friendly. Quick, we were discussing about how many views he has and so on.
Thank you, Manohar. See, I'm a consultant since past 40 years, I can say. Past 1 year, I'm very active in social media. I have got nearly 1 lakh followers. Simple tips in local language gives lot of courage to me, lot of encouragement to me. To tell you simple, this semaglutide, which was available for 15,000, 20,000, I made a 2-minute video telling that made in India. It's available for just 2,000 rupees. I have put and I have told the complications of that, how they have to take, and in nowhere I have mentioned my clinic name or my contact name. In spite of that, daily 3-4 SEMA I am starting. I am benefited a lot. I get referrals not from the doctors, but from the well-wishers in that Facebook media. But we have to be very careful. Lot of negative comments I do get, but I just neglect them. Thanks to Manohar for giving me an opportunity to express my views. Thank you.
If you have any more
Thank you so
questions,
much.
we can take it offline. Thank you so much.